Welcome back. 7:17 is your time, and the month of June goes to raising awareness about men's health. Doctors advise patients to consider some regular checkups rather than schedule appointments only when you feel sick. Dr. Scott Simeon with People's Health joins us now with some common myths along with some health tips. Good morning to you, Scott.
How you doing?
Very well, very well.
Right.
So the question is for guys, a lot of us put these things off, and the question is, how often should we be seeing the doctor?
Right. Well, it depends on your age, but yeah, like you mentioned, you know, men tend to avoid problems until it gets really bad, or they don't go in for their preventative health visits, or they don't even know what that is. Most men I see come in their 40s, 50s and say, oh, I haven't seen a doctor in 20 years. But depending on your age, it's usually recommended. I still recommend once a year, once you hit about mid-40s or so. But, you know, when you hit 40, it's time to start seeing the doctor for preventative visits. You know, certainly you don't want to wait until there's something wrong. But starting at age 50, I still recommend about once a year getting a regular checkup.
Yeah, and in those checkups, they're able to spot any sort of warning signs for what is perhaps the most common thing that men deal with as they age, which would be probably what, heart disease, would you say?
Well, heart disease is a huge killer of men. It's also a huge problem in the male population compared to their female counterparts. You know, heart disease, blood pressure is a biggie. You know, I catch many blood pressure patients or blood pressure problems in patients who never knew they had a problem before. And again, that's why it's important to get in for a preventative visit. You know, of course, prostate cancer, prostate health is another issue. You know, you want to make sure that you see your doctor at least once a year for a prostate check, PSA. There's some controversy about the blood test for prostate, but I still recommend getting it once a year. But again, these things I tell my patients sometimes, you know, do you get your oil changed? Well, why do you do that? Because it's time, not because something's wrong with your car. So if you take care of your body like you take care of your car, I think, you know, if you go for regular checkups, I think that's the important thing.
Yeah, no doubt about that. We had put up a graphic of some of the preventative things that people can do, especially men as they age, things that they could do to stay healthy, which include obviously the routine checkups, the good sleep, watching what they eat, just kind of taking good care of themselves as you age. I think that's one thing, and correct me if I'm wrong, when people look back on their lives, they go, I wish I would have taken better care of myself when I was younger.
The key is prevention, you know, getting enough sleep, eating healthy, get rid of the cigarettes. Cigarettes are the worst thing you can really do for your body. You know, so that's where the heart disease comes in. That's where a lot of that factors in. You know, just being male puts you at higher risk for heart disease than females.
All right.
So
yeah. We also want to quickly get in an event that's coming up here, a free seminar for any guys that are looking for some tips on how to stay healthy. It's coming up Friday, June 24th. 11 o'clock. This is at the New Orleans East Hospital there. A tune-up for life coming up, and we want to encourage people to get out for that. We appreciate it. Scott Simeon with People's Health. Thanks so much.
Thank you very much.